The voice of the drum calls. It sings a song of those who came before us and those to come. A song of survival and strength. A song of participation and voice. A song that calls us together. When we come together and participate in the 2010 census, we use this tool as the voice of all our Native people. Our voice. It is in our hands. 2010 census.
And welcome to this edition of the Native News Update on this Tuesday, May 11th. I'm your host for today's program, Paul DeMain. Many of the stories right here can also be found at our website at IndianCountryNews.com. Here are the news stories for the day from the Associated Press and other Native news sources. Tornadoes ripped through Oklahoma on May 10th, opening the season there while destroying over 100 homes. At least 5 people are confirmed dead from the storms, and the state was bracing for the potential for more as these storm systems set up the unique scenario for the potential of more tornadoes in the near future. The tornadoes ravaged Oklahoma City, Norman, Seneca, and Tecumseh, Oklahoma yesterday, leaving a path of destruction, flipping cars and mobile homes, and closing the interstates. Jeff Harjo, the executive director of the Native American Journalists Association, which is located in Oklahoma, drove by some of the properties of the absentee Shawnee and reported that the tribal store, clinic, and casino located 15 miles east of Norman, Oklahoma, were closed on the morning of May 11th. He also said he observed what to be roof damage on several buildings. Harjo also indicated that he had heard that housing for the Seminole Nation had been damaged but was intact. For the moment, the absentee Shawnee tribe has requested assistance for fuel generators and chainsaws. And in our continued discussion about health care, we go to Shoshone-Bannock tribal member Mark Trahant and his series with the Kaiser Fellowship on Indian Health Service, Jobs, Education, and Opportunity, and some additional comments about the recent nomination by President Obama of the Solicitor General, Elena Kagan, this week for the Supreme Court of the United States.
Mark Trahant, we got a couple issues going on today. We want to talk a little bit about Indian Health Service in your latest column, and then we want to talk a little bit about the Supreme Court. What would you like to start with today?
Well, let me start with health. I focus now, the last 2 columns actually, on different aspects of employment. And I think we've talked about this before, but it's important to note that the Indian Health Service is the largest employer in Indian country. And that has all sorts of ramifications.
Relatively small yet in terms of operations, considering how broadly Indian Health Service is throughout the United States, in all probably 38 states or more, something like that. But not the biggest corporate entity or biggest government arm by any means. Yeah,
they are. There's 15,000 employees.
The biggest Native American program that exists? Right. Okay.
The Bureau of Indian Affairs, for example, is down to about 7,000 employees.
Oh, I don't think that would be the conventional wisdom on the issue. I think you would think that the Bureau of Indian Affairs would have a huge apparatus for all the different things they're doing there. You see, right. You see growth. You see a doubling. Excuse me?
I'm sorry? It's happened in the last 30 years, the shift to IHS.
Okay. What do you see with Indian Health Service? Do you see it doubling in nature in the next decade or so? Or?
Yeah, I think just to keep up with demand, it'll have to double. Whether that will be government employees, though, or not, I think is an open question. One of the things I plan to write about soon is I think the math now works out in favor of tribes and Indian organizations that do 638 contracts instead of have Indian Health Service operations on their ground. And so I think contracting ought to grow to maybe 80%, 90% of the budget.
Does that give tribes more flexibility to do innovative things outside of the inner circle of 638 contracts?
Sure. I mean, the law opens up possibilities of demonstration projects and all that sort of thing. But what makes it compelling, at least in my view, is you can get foundation money. So you're not just limited to what the government doles out. You can raise additional funds to do what's best for your people.
Okay. You talked a little bit about employees being disgruntled with Indian Health Service in this last column? What did you find out in terms of people being happy or unhappy within that system?
Well, as you know, as a journalist, whenever you put something out there, you hear immediately from those who are not entirely happy with their lives. And I try to listen to those and to look at them in terms of public policy. And even if you think of the IHS having a workforce of 10% that's unhappy, that's still 1,500 people, and that's a pretty big number. So you kind of start from there. IHS has got some procedures in place right now to listen to people, and I kind of outlined those and what they're learning from that.
Okay. Did you find anything significant, any particular thing that led that negative feeling? Was it pay, salary level kind of things, or what was it that was hurting their image?
The data is interesting. The IHS for government agencies is pretty much in the middle. Bureau of Indian Affairs, for example, pays less than IHS. And the VA pays more. So they're right kind of in the middle of the pay scales. And that's probably appropriate given the rural nature of things.
You see a majority of people being concerned really about where they're going in terms of pay and salary and careers?
I think clarity of management. Some of the things the IHS does that completely frustrate me are the way they handle communication. For example, the idea that healthcare professionals need to get permission in the hierarchy before they can talk to the press. I think that's a 20th century idea, and it should be buried with the 20th century.
Yeah, because certainly social media and everything else is just the opposite and accessible to everyone.
And transparency is a currency now. The more transparent you are, the more it attracts resources.
Do you see the impact of tribal politics impacting Indian Health Service in any of these surveys of employees?
Oh, I'm sure that's a possibility. I haven't been able to drill down into the data. One of the problems, I think, is with the way IHS collects data in general. For example, I'd really like to know what the view of the workforce is within 638 contracts and self-governance as opposed to IHS employees. Is there a substantial difference? What are the areas of those differences? Those are questions that I just don't see in the data.
Yeah. Well, you're going to have to ask them, and we're going to have to ask you what the results are here in the near future. What do you know about the Supreme Court situation coming up here? We have a vacant seat, and there's an opportunity here. And what are you hearing behind the scenes?
Well, the new appointee is a former dean of Harvard Law School and Solicitor General, so she's at least argued for the United States, Alina Kagan. But what's interesting, I think, is beyond the court, and there was a call by a number of American Indian groups to have John Echohawk or some other American Indian considered for the court. But I think beyond the Supreme Court, you look at the entire federal bench, and there are nearly 1,000 Article III federal judges, and the number of American Indians or Alaska Natives is 0. And I think that's something that's just time.
So we got to percolate up some potential nominees in the future. It's not very often that they go outside of the judicial process, even though they do, to find their nominations and go into the business sector or some other sector. But percolating up judges one way to do it. Having more vacancies might be another way to do it. Is John still perhaps in the running in the long run if there's an opportunity?
I don't think so, and I think it's not because of his qualifications, but it's because of his age. These days, they look for very young judges. In fact, it dawned on me the other day, and my kids love this. I'm too old to be a Supreme Court judge at 53. They're looking for people in their 40s, and that's just pure politics. They want to outlive the opposition, and you do that by appointing young people.
Appointing young people and watching them there for 40 or 50 years until they wheel them out of there in a chair sometimes.
Exactly.
All right.
Exactly.
Okay, Mark, thanks for joining with us. We'll do it again here soon, and we'll update the people on this Indian Health Service and keep in touch.
Look forward to it.
And that is the latest roundup of the news from Indian Country in this edition of the Native News Update. We want to thank you all for joining with us. Miigwech.